Did you know that metabolic dysfunction is at the root of nearly every major chronic health condition? From type 2 diabetes to heart disease, Alzheimer's, and even certain cancers. It all ties back to how your metabolism functions. And yet, it's something so few of us fully understand. Today we're diving deep into metabolic dysfunction, what it is, why it matters, and how it affects every major system in your body. This isn't about pointing fingers, it's about understanding the problem so that we can take steps to address it. Let's get started. Let's start by breaking down what metabolic dysfunction actually means. Your metabolism is how your body processes food and turns it into energy. Metabolic dysfunction happens when this process doesn't work properly, leading to imbalances in blood sugar, cholesterol, and fat storage. It's like your body's engine is running out of tune. Fuel isn't being used efficiently, and that creates a cascade of problems. Common indicators of metabolic dysfunction include high blood sugar, insulin resistance, excess abdominal fat, high triglycerides, and low HDL cholesterol. Over time, these imbalances damage organs and lead to chronic diseases. In short, metabolic dysfunction isn't just one issue, it's a cluster of interconnected problems that strain your body's ability to function at its best. Let's talk about why metabolic dysfunction matters. This isn't just about numbers on a blood test. It affects every major system in your body, and here's how. In the cardiovascular system, metabolic dysfunction is a key driver of heart disease and stroke. Elevated blood sugar and cholesterol levels lead to plaque buildup in your arteries, increasing your risk of heart attack and stroke. In the endocrine system, it plays a direct role in type 2 diabetes and insulin resistance, where the body struggles to manage blood sugar effectively. Left unchecked, this can damage nerves, kidneys, and more. In the neurologic system, metabolic dysfunction increases your risk of Alzheimer's and other forms of dementia. Some research even call Alzheimer's type 3 diabetes. This is because of its strong link to insulin resistance. For liver and digestive system, excess fat in the liver, known as fatty liver disease, is a direct result of metabolic dysfunction. Over time, it can lead to liver failure and other complications. In reproductive health, metabolic dysfunction is linked to PCOS, infertility, and complications of pregnancy. For men, it's associated with reduced testosterone levels and erectile dysfunction. Finally, in the immune system, chronic inflammation causes metabolic dysfunction, weakens your immune response, making you more susceptible to infections and slowing the healing from injuries. This is a quick overview of the impact of every system in your body. Comment below if you've had any of these signs or symptoms. Subscribe so you can follow as we get in depth and cover each condition related to the symptoms and how to improve them. There are several factors that contribute to metabolic dysfunction. Some are within our control, while others, like genetics, are not. Let's focus on the major drivers. Diets high in refined carbs, added sugars, and trans fat promote insulin resistance and fat accumulation, especially around the organs. These foods disrupt your metabolism over time. A sedentary lifestyle is a major risk factor. Physical inactivity reduces your body's ability to use insulin effectively, worsening metabolic dysfunction. Carrying excess visceral fat, the type that surrounds your organs, creates a hormonal imbalance that worsens insulin resistance and chronic inflammation. While genetics can predispose you to metabolic dysfunction, they don't guarantee it. Lifestyle factors play a significant role in determining outcomes. While understanding genetics is important, focusing on controlled factors like diet and exercise is where you'll see the most impact. So, how can you tell if you have metabolic dysfunction? Here are some of the key indicators to watch for. Metabolic dysfunction, or metabolic syndrome, as we often refer to it in traditional medicine, is diagnosed when you have at least 3 of the following: high blood sugar, high blood pressure, high triglycerides, low HDL cholesterol, or large waist circumference. These are all markers of metabolic syndrome. Even if you don't meet all the criteria, experiencing symptoms like fatigue, sugar cravings, or difficulty losing weight can be early signs that your metabolism isn't functioning at its best. Today we covered what metabolism dysfunction is, why it matters, how it impacts every major system in your body, and some of the main causes behind it. Remember, this is the core issue driving so many chronic health conditions. In our next video, we'll dive into actionable strategies to improve your metabolic health. Simple changes you can make today to start seeing results. If you found this helpful, give it a thumbs up, share it with somebody who could benefit, and subscribe to stay informed as we explore how to take control of your health. Until next time, stay healthy and heal well.